Hello, I'm Dr. Tanvi Haldipurkar and I'm the Cataract and Refractive Specialist at Laxmi Eye Hospital. People who have refractive errors, meaning that those patients who are wearing glasses for seeing clearly, they have refractive errors. And refractive surgery is that procedure which is done on the eye which can give you freedom from that glasses. So refractive procedures are mainly cornea based. That means that there will be some lasers applied on the cornea which eventually help reshape and thin it so that we are able to remove the refractive error that you had. Now the corneal procedures are again divided as something where you directly apply laser on the eye, which is called the surface ablation, commonly known as PRK. Now here the top layer of the cornea, which is called the epithelium, is removed, and then we laser out the top part of the eye, reshape it according to your refractive error or the number, and then we let that layer heal back again. So it takes a couple of days, maybe 3 to 4 days for that epithelium to heal back. So the patient does not see very clearly right the next day. He may take up to 3 to 5 days for the vision to improve, and of course the drops have to be put for few days to few months. The next procedure is commonly called as LASIK. Now LASIK essentially means that the cornea has to be made, or rather the cornea is worked on. We make a flap, we raise it up, and then the remaining corneal tissue is again lasered with an excimer laser, the same as the surface ablation. So both these procedures are reducing the corneal thickness. That's why it is important that we first see, do you have enough corneal thickness to work with? Is your cornea strong enough that we can do something on which will last you for your lifetime? The next option of refractive surgery, again which is cornea based, is called the lenticule extraction, or the commonly known word is CLEX, keratolenticule extraction procedure. Now there are different machines which do the same. Most commonly known, or the most oldest one, is the SMILE procedure. Now we have the clear, we have the silk, and we have the ATOS. So all of these different procedures are essentially removing a lenticule, that means a thin layer of corneal tissue through a small opening which may be around 2 or 3 millimeter in size. So because there is no flap there, we are just removing it through a tiny incision. It is essentially a flapless procedure. A major advantage with any of these CLEX procedures is that it does reduce the dry eye that gets induced after surgery. Most patients of LASIK do have this problem, but again it gets solved after a few months with some sort of drop regime. But if you really have dry eye to begin with, we do advocate you go for a CLEX procedure like the SMILE, clear, which will give you less dry eye after surgery. These were the cornea refractive procedures. Then we come to the lens-based one. Now what happens is sometimes your cornea does not have enough tissue and we really can't work on it. So now what do we do for these patients? So fortunately now we have options where we can put a lens inside the eye. So if you have a number of -2, -5, -12, -34, which we've operated in our center, you can still get rid of glasses. So we measure the power, we make a custom made lens fitting for your eye, and we implant it inside. So it rests on top of your natural lens and it happily sits snugly inside the eye, and it gives you the freedom of glasses that you want. There are a lot of patients who are in their 40s, in their 50s, who've been wearing glasses all their lives and now finally don't want them. So we have options for them also. But here what we do is we take out their natural lens and we put a trifocal lens in their place, which can then again give them the freedom of glasses for both distance as well as near. So today, fortunately, we are in the time where anybody who wishes or desires to have spectacle-free vision can get it. But there is no one best procedure that is suitable. Somebody comes and says, my friend has got SMILE, I need to get it too. Well, you may not be eligible for it. So it's important to go visit a refractive surgeon, have a look at your eye, discuss the options with him or her, and then take a decision. Thank you.